Well, I think that's precisely the point, which is that the study results, which have now been confirmed, in fact, today by Wits University, by Professor Shabir Mahdi, show that the AstraZeneca Oxford vaccine is of minimal effect on the variant that is now dominant in South Africa. And what that really means is that the doses that we received a week ago of this vaccine will be of very, very little use at this point in preventing COVID-19. So I think that it is disappointing, to put it mildly. It is a big setback to our vaccination program and the hopes that we had built up, particularly given that healthcare workers were the first in line, necessarily so, to receive this vaccine. And it is going to require that our government and our scientific research community move fast to come up with a plan B. What I would say is that we know that at 7 o'clock this evening, the health minister, Zweli Mkhize, together with the researchers, is going to be holding a live press conference. I think they will further clarify the meaning of these results, but also, I hope, begin to offer some guidance on how South Africa will move forward from this information.
The hope was to reduce or completely at least eliminate the burden of hospitalization. Now, with the vaccine only able to significantly, well, at this point, to not significantly reduce the virus in moderate to mild cases, the severe cases have not yet been confirmed or tested. What does that mean? I mean, does it essentially mean that we might have mild to moderate people with the disease out there continuing to spread, but we will be able to at least reduce the number of those who are hospitalized?
Yeah, so that's something that the researchers will explain far better than me this evening, but let me do my best to explain now. The first thing I'd like to say is that one thing we do know about this vaccine is that it is completely safe. We do know that this vaccine worked in what we call the wild type virus, which is the virus before the variant, before the mutation took place. We now know that it doesn't work in mild to moderate, but counterintuitively, it is still possible that it may work in preventing severe COVID-19 disease and therefore may work in preventing people from dying from COVID-19. So it's the nature of this beast that we're dealing with at the moment, that we are constantly encountering new scientific questions. Vaccine development is a process of trial and error and elimination. So although this is disappointing, and there's no pretending it's not a setback, it is by no means the end of the story. In fact, it's a beginning of a new area of questioning and research, I would say.
Yeah.
The other thing, if I can just also point out, just very quickly, is that we have other vaccines in our armory. You know, the last few weeks have seen a flurry of trial results published also by Johnson & Johnson with their vaccine, also by Novavax, both of which were tried on the South African variant and which did show efficacy. So our cupboard is not bare as a result of this latest piece of news. We still have a whole series of options.
Does this mean we now need to shift our approach to this pandemic from having herd immunity to protection of all at risk?
Well, look, we will have to continue an approach that says to every single person, you have to wear a mask. You have to practice social distancing. You have, to the best of your ability, to practice hygiene and hand washing, all the things that government has said for nearly a year now that people need to do to protect themselves will need to continue for at least the whole of this year, I'm afraid to say. Side by side with that, we are seeking the vaccines as a way to provide immunity through vaccination, and that will continue. And there's no doubt that the vaccine program will continue and may well take place with even greater urgency as a result of today's information. So I guess the message we have to get across is there are two parallel streams, each equally important to COVID-19 prevention. One is the individual behavior changes that we have to try to effect to benefit ourselves and our communities. And secondly is the medical and scientific interventions, which are also going to be critical. What some people say, ultimately the silver bullet in helping us to overcome this pandemic.
What the study does indicate, though, is that there are some caveats to this particular study, and I'd like to get your view on these caveats. For example, that the sample size was quite small in terms of the 2,000 that were tested with this one, but also those who were tested were young, median age 31, HIV negative. Half of those who were tested took one dose of the placebo, the other half took one dose of the vaccine. I mean, those caveats, how do they play into how we read this outcome?
So they're both, you're correct to draw attention, they're both very important caveats. And they're more than caveats. They are, if you like, limitations to do with this particular trial. It was a relatively small trial, 2,026 people. And as you say, it was amongst young people who we know already are less prone to severe COVID-19 illness, which is why, as I've said earlier on, and as the scientists are saying, this is not the end of the story. We don't, the point is, we're not discounting that the vaccine may have benefits for people with severe COVID-19, people who are hospitalized. We just don't have the evidence. We don't have the proof yet. And I guess that is the challenge that government now faces, because we have a vaccine in storage in South Africa, which we've received from the Serum Institute, which clearly does not work against the variant, at least in its ability to prevent mild to moderate disease, and which we do not know enough to say whether it works to prevent severe disease and death. So the conundrum that government now faces is what to do with this vaccine and how to continue to move with the greatest urgency to start a vaccination program, and particularly in the first instance to protect our frontline healthcare workers. And I guess we'll hear more about that in half an hour when the minister, together with the researchers, Professor Mahdi, Professor Gray, and others, unpack these findings with in more detail than I'm capable of doing here.
Yeah. Now, in terms of the minister and the address, and of course it will be purely us just speculating what he will be saying, but what do you say to a South African population that already has vaccine hesitancy quite high? I was talking to a health worker yesterday who's saying he himself, as a health worker, has got very high vaccine hesitancy. In fact, he will not be taking the jab, and he says he's not alone. In fact, there are other nurses who are also feeling there's not enough communication. They are not being told how this whole process works. They're not being told what's in these vaccines, yet they're expected to go out there and educate the public on these things. So if you're a minister, Dr. Zweli Mkhize, and you've got to address the nation today following this headline, what do you say?
Well, I would agree with the people you've spoken to. We have to massively improve the quality of communication to all people in South Africa about these vaccines. And that must go beyond just saying to people that you should, and it's in your best interest and it's community interest to take a vaccines. What I learned from my work on HIV and AIDS in the Treatment Action Campaign is that communities now need to understand the science of what makes a vaccine work and what makes a vaccine fail to work. Communities need to be taught to understand why these vaccines are safe, and they are all safe. Let me stress that the regulatory authorities have shown that they are safe. Even this vaccine, which we now doesn't work against the variant, is a safe vaccine. There are no questions over its safety. So I would say that we need to be investing far, far more in helping people to understand and communicating these issues than we are doing up to this point. But in answer to your question directly, I don't think that this should cause greater vaccine hesitancy, greater vaccine skepticism. In fact, if anything, it shows that our research systems are working, because when a vaccine shows that it doesn't work against the virus, despite the fact that it's going to be a major setback and inconvenience to government, to the company concerned, and so on, it is immediately made public that it doesn't work. So nothing is being hidden. And that should make you believe that the vaccines that do work, where we have the evidence that they work and which are being used widely throughout the world, do indeed work and are bringing benefits to the people who receive them.
Maverick Citizen editor Mark Heywood, appreciate your time.